Hello, the following is a case study on an 8-year-old girl named Sue. Sue is an 8-year-old girl who is experiencing symptoms associated with social anxiety. She is the third child born and youngest of the family. She has two older brothers and lives with her mother, father, brothers, and grandmother. The family immigrated from China to America when Sue was 2 years old. Sue is having difficulty functioning appropriately in school, and Sue's mother has brought her in to assess her symptoms and hopefully find a treatment plan that will help Sue go to school and stay at school without a problem. Sue is showing avoidance behaviors when it comes to going to school. Sue's mother is frustrated with her daughter and knows that her daughter is falling behind academically and most certainly socially. Sue's crying and carrying on when it's time to go to school makes each morning very challenging for the entire family. Sue also often frequents the school nurse's office complaining of stomach and head pain. The purpose of this presentation is to analyze Sue's symptoms, determine if there is a diagnosis, and what those possible diagnoses are, as well as propose a treatment plan for Sue and her family. Symptoms Sue's symptoms of anxiety include fear of separation from family, especially mother, crying, angry outbursts, persistent fear, persistent defiance, throwing up, developing hives, clinginess to mother, worry, fear of impending doom, antisocial tendencies, lacking of friendships or meaningful relationships outside the family. The symptoms that Sue's exhibiting certainly define anxiety. With Sue's mother already at a frustration level, Sue's symptoms are increasing in severity as well as intensity. Sue's struggle with anxiety is keeping her from performing academically and will eventually lead to academic struggles if the symptoms perpetuate untreated. In order to diagnose Sue with an anxiety disorder, these criteria must be met according to the DSM-5. Persistent and excessive fear, persistent and excessive anxiety, refusal and determination in leaving home, hyper-attached to mother, persistent and chronic physical complaints of stomach and head, symptoms persist longer than 4 weeks, child's academic and social development are severely impaired, and another diagnosis is not present. The key to these criteria is that they are persistent and chronic. Now, any child can show one or a combination of these symptoms at random times in their development. However, if these criteria are impeding on their progress, both academically and socially, and development of the child, then professional care should be sought out. With Sue meeting each criteria over a significant period of time, a diagnosis should be given and a treatment plan should be made by Sue's team of supporters, both educationally as well as medically. Now, the first possible diagnosis for Sue, and the primary diagnosis in this author's opinion, is a separation anxiety disorder. Sue absolutely meets the criteria for having a separation anxiety disorder. To quote, a child may have separation anxiety disorder if separation anxiety seems more intense than other kids of the same age or lasts a longer time, interferes with school or other daily activities, or includes panic attacks or other problem behaviors. Most often, separation anxiety relates to the child's anxiety about being away from parents or guardians, but it could relate to another caregiver as well. Quoted by the Mayo Clinic. For years now, Sue has shown high levels of anxiety and fear upon leaving her home, a family member, and especially her mother. It's interesting to note here that there isn't a separation of Sue's mother and Sue's grandmother either. Being Sue's grandmother lives with them, it would be thorough to conduct a little more research on the lack of separation intergenerationally. Now, a second possible diagnosis for Sue is social anxiety disorder. To quote, social anxiety disorder involves an intense fear or phobia of social and performance situations. End quote. Sue certainly meets the criteria for having a social anxiety disorder. She does have an intense fear of being with anyone other than her own family and does all that she can to avoid social situations. While the symptoms of social anxiety disorder are similar to those for separation anxiety disorder, the key difference is the debilitating attachment Sue has with her mother. Having a social anxiety disorder will keep Sue from developing relationships with people outside of her family. A significant piece in human development depends on the relationships that we build as we grow. It's through these relationships that we learn who we are and how we behave. With a solid treatment plan, Sue will be able to build those relationships and develop in a healthy manner, working towards having a happy and healthy life. There are two family members who fly under the radar and show an environmental risk factor to Sue's development. And those people are Sue's father and grandmother. While Sue's while Sue's mother is the primary caregiver, Sue's father and grandmother also play a significant role in Sue's struggles with anxiety. When Sue's grandmother speaks of eating bitterness, this is of cultural significance. This ancient Chinese saying references having a confident, conquering mindset rather than Sue's mindset of dependence. Sue's grandmother does not see the significance of Sue's anxiety, not taking it seriously and needing a specific treatment plan. Now, Sue's father is also contributing to the risk factors in Sue's life. With his hesitancy in seeking therapy for Sue, he is limiting her progress forward. A significant piece of Sue's treatment plan should include therapy of multiple disciplines, and Sue's father may very well stand in the way of that progress. The treatment plan for Sue, beginning at home. Sue's treatment plan needs to include therapy. Not only will Sue benefit from individual cognitive behavioral therapy, but the family will also benefit from having family therapy to include all family members. Through cognitive behavioral therapy, Sue will be able to learn coping skills to manage her behavior. CBT will also allow Sue the opportunity to identify the problems that need to be addressed. Now, to continue her treatment plan at school, Sue's educational support system must be informed of what Sue is struggling with. This team is an integral part of the plan of Sue's treatment plan in that her progress forward depends not only on Sue, but her teachers and school counselors as well. Sue's teachers can help Sue manage her behavior by developing a behavior management plan within the classroom, reinforcing healthy behaviors that she exhibits rather than focusing on her avoidant behaviors. Teachers can develop a system for Sue in which she gives the teacher a physical cue that she needs some quiet time or a short break. Teachers can provide the safe space for Sue in the classroom where she can decompress and practice healthy coping skills. More specifically, teachers can work together to develop a 504 IEP, Individualized Education Plan, for Sue that addresses any accommodations or modifications needed for Sue to be successful within the classroom environment. The treatment plan doesn't just stop with Sue or at school. The treatment plan continues with the family as well. Family therapy is a necessity for Sue's family. Through therapy, Sue's family can address the issues that have surfaced regarding Sue's behavior as well as her academic progress. To quote, family therapy may be helpful in cases where family dynamics contribute to SAD. Family therapy involves working with family members to identify and modify behaviors that may reinforce or exacerbate a child's anxiety. End quote. Sue's family dynamics do contribute to Sue's struggles in that her father is not supportive of the therapeutic process. Her grandmother believes that Sue just needs to be tougher, and her mother is simply all out of options in her mind. Not only would family therapy help Sue, but individual therapy for her family members would also be beneficial. Now, to conclude, Sue is not alone in her diagnosis of an anxiety disorder. Thousands of children and adolescents struggle with some level of separation or social anxiety disorders. However, it is key for Sue to receive a comprehensive treatment plan as well as an individualized education plan for her to continue on her path of independence. In order for Sue to find academic and social success, her symptoms must be managed through a variety of methods, according to the recommendations of her medical professionals and family input. It is essential that Sue has a support team in her corner that includes her family members, school professionals, and medical professionals. By working together, this team will be able to create a world for Sue in which she is not weighed down with worry, fear, and isolation. Rather, she enters a world of confidence and healthy relationships to help her grow into the amazing person she was born to be.